Oh boy. I guess Erlen forget our earlier conversation. Erlen, I am still Miss Wilson, not Mrs.
Oh, yes,
Yeah.
yes, 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 yes. Yeah,
Oh boy.
yeah,
You want
yeah,
Rome
boy.
you want Romanas to come and give me the how should I say it?
Proposal, ba?
Not the proposal, the fate of a lifetime with
Oh,
all
okay,
his
pa,
DJ
theater. Theater
skills and
soloist.
so on.
Yes,
You
yes.
understand? For that wedding, so you already contracting Romanas this
I
morning.
just bring you plenty of
Oh
luck.
wow.
I bring you plenty of luck. It's been long overdue.
You know?
It's been long overdue.
So good morning, everybody. It's always a pleasure to be here. This morning, I would like to thank all our listeners. A lot of persons have been giving us feedback and so on. I'm really happy for the feedback by our listeners. Let me say good morning to our persons at MNC Drugstore, Hotel Chocolat, persons listening online, and our people from countries, all our listeners from countries, Choiseul, as well as Soufriere. It's always a pleasure to be on Casualty 911. And this morning we have an exciting topic. And it's a topic that most of us tend to shy away from, but we have been having these topics all year round, at least once a month. It's all about mental health. And this month, it's World Mental Health Day is recognized on the 10th of October, 2023. And we have quite a few persons with us this morning. I will allow them to introduce themselves
Go ahead.
and then we can dive right into our program this morning. So, good morning, everyone.
And
Are you all
When you
hearing?
say everyone, you have to be specific.
yes, I'm hearing. Good morning.
Good morning.
Ladies,
Good morning.
All right, wonderful.
Good
Um,
morning. Can you hear me?
nice and clear, loud and clear.
Sure.
Nice.
so, I will allow you all to introduce yourselves.
Okay. My name is Mathelda Demar-Previlus. I'm a clinical psychologist and the head of the psychosocial department at the Millennium Heights Medical Complex.
Hi, good morning. Thank you for having me. I'm Alicia Seshis, mental health psychiatric nurse practitioner with community health nursing. I work in the Castries and ancillary area. Thank you.
And nurse also has have worked also in the Soufriere area for quite a number of years. The Soufriere Choiseul countries area nurses.
Yes, yes, I did.
Wonderful. Let me just say, we normally mental health is something that a lot of us shy away from, and in the community, the stigma that is attached. And today, October 10th is recognized as World Mental Health Day, and I mean, we want to create awareness in our communities, especially with families and so on. So we welcome the opportunity in having you all here today. And in reading yesterday, um, I was reading a little bit about on WHO, and the theme for today, the theme for Mental Health Day is mental health is a universal human right. And I'm so glad for that topic, because in reading, the objective of World Mental Health Day was to raise awareness and of mental health issues around the world, and to mobilize efforts to support mental health. I know the mental health team in our ministry have been doing quite a bit. I know it's a very short, small unit, and I must say that I've learned quite a bit, because this team have embraced us with the Bureau of having one mental health topic every month on Casualty 911. So a lot of awareness is going on in our communities. Also, the training that have been provided to other health professionals via Zoom meetings have also been very educational to even us health professionals. So I must commend you all on all that effort and even more that I might not mention. You have been doing as the mental health team within our ministry. So, having said that, I will allow either one of you to speak about. I will start with, well, I'm more familiar with Neseji. Sorry about that. I will start with Neseji, then afterwards, we will. I'm sorry, I didn't get the other name.
Sure. There we go.
Mrs.
Mrs.
Previlus.
Mrs. Previlus. Sorry about that, Mrs. Previlus. So I will start with Neseji, and then we will afterwards, then you will speak, okay? Neseji, go right ahead.
Okay, good morning again. Yes, so I'm talking on the community part. So mental health, the theme for this month is mental health is a universal human right. And when we look at human rights, we always talk about rights, rights. Everybody has rights, but we want to ensure that persons have the right to care, right to care, access to care, the right to be protected from mental health problems, the right to freedom to choose mental health care. So these are the things regarding the theme. So like you said, the theme is very timely and interesting because at this time, since we went through COVID-19 and we talk about the new normal, we know we have not gone back to new normal. So all of the pressures on persons' mental health, there have been a lot of pressures on persons' mental health. And we want them to know that they have the right. They have the right to mental health care. They have the rights are there. And also the services are there. So in the community, we have a mental health clinic at each health center on the island. So at least once per month, there's a mental health clinic at each health center on island. And some of the services that we offer from the mental health, community mental health, we have home visiting, we have medication monitoring, we have health promotion, health teaching and counseling. We also do school visits, workplace visits. We do assessment, early detection and diagnosis and treatment. We do crisis interventions. We take part in health fairs. And doing all of this, we have a team consisting of a psychiatrist, a psychotherapist, uh, mental health psychiatric nurse practitioners, community nurses, and health aides. So, and for Soufriere, we also have the hygiene program for Soufriere, where the clients are taken in for a bath. So these are some of the services we have for mental health in the community.
I'm sorry about that. This is the first time I'm meeting you, so the name seems a little bit. So can you please tell us about the services that are being offered at OKEU?
Okay, so at the Millennium Heights
Oh,
Medical
Millennium
Complex,
Heights. Sorry.
so it's an institution that is made up of three parts. We have the OKE Hospital, we have the National Mental Wellness Center, and the Turning Point Rehabilitation Center. So at the National Mental Wellness Center, that's basically our psychiatric hospital. And there we provide psychiatric care, we provide psychological care, nursing care. We have clinics on Tuesdays, Wednesdays, and Thursdays between the hours of 8 to 12:30. And there you'll see a consultant psychiatrist. And from there, you may be referred to counseling services, which is free. And also, we have social workers on board. If you have any social issues that we can address, we assist or do the necessary referrals. We also have the Turning Point Rehabilitation Center that deals with addiction, mainly alcohol and drug addiction. So if you have any challenges there, that is a paid service though. However, we provide counseling to substance use issues as well. Um, like I said, our services are free. However, because we are a secondary care institution, we don't offer walk-in services. You have to be referred by the primary care facilities, such as the health centers, the community health centers, a counselor, or doctor. You can get that referral and come in, and we will assist. We will take care of you as well. And one of the things that as solutions, we have this stigma when it comes to our mental health. We pay more attention to our physical health than our mental health. And it is equally important. Just imagine somebody with a mental health condition, they may have difficulty taking care of their physical health, right? So it is very important. And so we have to take care, equal care of our mental health, just as we're caring for our physical health. So if you're diagnosed with diabetes and you're not supposed to be eating sugar and this kind of thing, the same thing for your mental health. If you realize that you're stressed out, then you do the necessary so that you can manage that. So it does not become chronic and that it affects your day-to-day life. Yeah.
Wonderful. In hearing you, nurse, I didn't quite catch your designation a while ago when you introduced yourself. Can you please repeat your designation?
For me, so I
Yes,
am a clinical psychologist, and I also
wonderful.
manage the psychosocial department that is made up of counselors, social workers as well.
All right. I know you said you're a clinical psychologist.
Yes.
Wonderful. Can you tell us a little bit? Because I mean, we have our listeners, and sometimes we really do not know what a clinical psychologist do. Can you just give us a little feedback on what exactly do you do apart from it?
Okay. So a clinical psychologist is slightly different from a consultant psychiatrist, and the difference is that we do not prescribe medication, but we diagnose for mental conditions, we treat, we provide psychotherapy, we provide counseling, and also we refer to the necessary agencies that we are not able to, for example, social services and so on. But we basically provide psychotherapy as well as assessment. We do psychological assessments. That could be psycho-educational assessment, where school, when you're looking at children that have issues with school, um, probably academics, or somebody that may have a psychological issue, a mental illness, and we may want to understand what it is. So, for example, somebody who is autistic, you may want to know what that person, what the severity of it. So, we can do an assessment to determine that. Somebody with an intellectual disability, you may want to confirm that. So you do an assessment so you can know, the severity of that, whether it is mild, moderate, or severe, and so you know what kind of treatment to provide that person with.
Thank you so very much. I have a question for both of y'all. Feel free to, if you have anything you want to add, both of you. But I have a question. Within our society, I know you said Turning Point is part of Millennium Heights and Mental Wellness Center as well as OKEU. One of the things that we're currently seeing in our communities is um, the drug use among our teenagers, and some of them want to break the habit because apparently there is some level of addiction right there. What is the process in the event that maybe let's say a young man who is 14 years is already smoking, and he now realizes actually addicted to, let's say, marijuana, and he wants to stop the habit. How would you advise a parent from your end? How would you advise a parent? What would the process be, and how they can go about doing such?
So just want to go ahead.
The sages or
Yes.
either one?
Well, I can speak to the community part, and Miss Previlus will speak to
Yeah.
the hospital part. So if the person wants to stop, the key thing is that you want to stop. Because
Mm,
most persons, if they don't want to stop, and we try as we try, they may not stop. So you could come in for an assessment at the health center. And by the way, our services are also free, and anybody can come in to the services. So you would come to the one of the health centers and talk to the nurse, and from there you get a referral to Turning Point. So when you get a referral to Turning Point, Miss Prevalus,
Yes. So when you
The
do
person
get
is
that
a minor.
referral,
If he's a minor, they have to come with a parent, right, nurse?
yes, you need
yes, their
consent.
parents, yes.
So the parent accompanies the that child to
Mhm.
turning point, and there an assessment will be done to determine the person's the requirements, so whether they meet the requirements, and so we have inpatient, which is residential, and we have outpatient services. So most at the moment, well, mostly we provide at Turning Point is residential. So if you're at Turning Point, you have in your mind you're going to spend a few nights there, you're going to sleep there. However, we have the outpatient service where a child, 14-year-old, he may realize that he has an issue, but is it really that he's so addicted? Is it that he's really chronic? We have to assess for that.
Mhm.
And after that assessment is made, you will see which is best for him, whether it is residential or outpatient service, right? And provide him with some counseling, psychoeducation as to the dangers in smoking and so on. A child who is smoking at 14 years old, you causing damages to your brain because your brain is really developing and up until 25 years old. So between up until that age, 25, if you engage in smoking, marijuana, whatever it is that you're smoking, it may have an impact on your brain. And so that is putting you at risk to develop a mental illness. So as much as possible, we will help that child to understand and to, move away from that bad habit and to adopt more healthy behaviors.
Thank you. Now, one of the reasons must be saying why I did ask that question. One of the reasons I asked this question is now you're seeing a lot more younger persons engaging in smoking habits, and in speaking to those older persons, um, they will tell you that they started smoking at such an age, and now they're, let's say, 25, and they're still smoking. And, it's so difficult for them to get out of that habit. And so, for those persons who have already started smoking at such an early age, I wanted them to hear what services are available, and also their parents also what services that are actually available for them out there, and how they can assist them at that early age, to prevent the habit until they get older.
Mhm.
Um, Nurse Segis, you spoke about one of the things that is being offered in Soufriere is the hygiene part. And I could attest to that, yes. The hygiene part is being offered in Soufriere. But one of the things that I realize is that um, the effort on us health professionals are there, but then the effort on some family members are not there. Do we have anything in place apart from the counseling to help family members understand persons with mental illness and how they can cope with those persons? Any one of you could answer.
We don't have any set program in place for family members, but we do education when they come with the family members. We always encourage, do not send the persons alone, come and ask questions. So we do have home visits where we talk to family members, but when they come in, but we don't have any set programs for them. One thing I wanted to say, when we talk about come with your parents, come with an adult. Sometimes they may not have parents, and we don't want to neglect persons or don't offer care. So you can come with an older sibling, you can come with a friend, you can come and you'll find somebody for you to come to. So once you need help, come to the center and we will sort it out from there.
Okay.
Okay, thank you.
You want to add anything, Mrs.
Um,
Previlus?
no, because I don't work in the community. No, but the same thing. If the persons do not have an adult cannot assist for the services. It doesn't have to be a parent, because sometimes the parent is too busy, the parent is not interested, and so you have that person that may not even be a family member who is interested in getting that person the help, and so we look at it on a case by case basis. We look at it.
Um, yeah, that is true, and I'm so glad Nurse Sergis brought that up because most times young children have the habit and they tend to hide it away from their parents, and they're not comfortable in discussing it with their parents. But however, maybe an aunt or an uncle, you know, they're more um, they're more comfortable with them, and these are the persons they might, bring along with them. Um, Another question I have. Well, do you before I ask questions, do you have anything you want to add?
Let me just add on what you were saying about the family members. Our clinics are not for persons, only persons diagnosed with a mental health condition. We also look at persons with mental health issues, persons with concerns, persons with queries can come in. A few years back, we have had a couple of them. We have had caregivers conferences where we invite relatives of persons with mental health conditions, and we have given them information at these cases. But you can just come into the center and ask for information, and information will be given. Maybe we should organize something again, but this is what we do. Thank you.
Yeah. Um, I know this because sometimes whilst our nurses are at the clinic, you have family members come in and they want to speak to somebody that can guide them, and the services are available as long as, one of the things we have to bear in mind too is that our nurses are not always in office, especially to the public, because, like you said, you do field visits, you do community, you go out in the community. So I mean, there are times where you're not always in office, and the public have to bear that in mind. So for example, let's say nurse Regis is scheduled at Soufriere Hospital, but however she has scheduled dates for different health centers within our region. So when you come in, it's always wise, I mean, to leave a message or leave a number where the nurse can get back in touch with you if you have any questions or queries. Because I, for one, have met people, they came to nurse, well, not nurse Regis, it was nurse, oh my God, I forgot which nurse. Um, Somebody came and I said, she's not in. I think at that day she was at one of the wellness centers, and the person didn't want to understand that. And I'm saying the nurse is not always at the hospital. The nurse also functions at different wellness centers. And throughout our program, this last year and this year we have been saying where the clinics are, which communities, and where you can go for the services island wide. Yeah. Um, I I have another question I want to ask. I know a lot of persons suffer from depression and they're not even aware that they're suffering from depression. And many times, you know, the services are available, but like Mrs. Previlus said, the stigma attached. Um, it's so common that persons are afraid to seek the services. I'm wondering what is in place because we know stigma is one of the things that really shy away from people from coming into our wellness centers or thing to come and get the services that are available. So what is the ministry really doing to try to curb the stigma apart from the awareness? What is the ministry currently doing to try to curb the stigma as it relates to mental illness and how we deal with it within our community?
Okay,
For
I
me, I
don't.
cannot.
Anyway,
Okay, sorry.
they're just in the trend of thought before they answer.
Go ahead, Miss Revelers.
Well, I cannot speak on the ministry, but at the Millennium Heights Medical Complex, what one of the things that we do at the National Mental Wellness Center is to provide um, outreach with even within the clinic itself when persons come, because you find that persons come to the clinic but they are accompanied by a family member or friend, so we use that opportunity to educate them on mental illness, different aspects of it, the importance of medication adherence, depression, the signs, the symptoms, anxiety, different things that they need to be aware of so that they can better assist that person that in the family member who is suffering with a mental condition. So we start from there. And hopefully at some point we can partner with community nursing and do more community outreach where we can provide that education, because education is very important. We find out when persons do not understand the things that they need to, they shy away from it, or they are not coming forward. But if they understand it and the importance of it, and you find that they are more open and more willing to participate and support where they can. So education is very important to help break stigma, and we have to do it as a team collectively. Yes.
Nurse, you want to add to this?
I will add to it. What we are doing in community for stigma, well, education is the biggest part to debunk the stigma and the myths. So we doing a lot of health promotions. What we most countries over the world, what they did, they moved from the hospital-based care into community-based care integration. So we have had integration where we have had the services now at each wellness center. And also in 2020, we trained doctors and nurses in a program called MH Mental Health Action Program, which is a program to help bridge the services. So these doctors were trained in the basic mental health conditions and how to treat them and how to make the necessary referrals. So you find that some of the doctors and nurses you meet at the health center will easily pick up the depression, the anxiety, the psychosis, the self-harm, and able to follow an algorithm which says what next step to go to and make the necessary referrals so these persons can get earlier help. So these are some of the things we have done so far to help with the stigma.
Thank you, Nurse. I'm really happy you said that. It's not always about, um, teaching community members, but our very own health professionals do get the training where they can pick up at a very fast pace and where the intervention can also happen within our health sector. That's a very good effort on the ministry's part. And let me just say, one of the reasons why I am asking these questions is that a lot of people out there in the community, they're quick to say, what are we doing to as Ministry of Health, or persons as persons in the health professional, what are we doing to help these things? And all these programs are right there. It's just that they're not aware of it. And like Mrs. Previlus said, that the simple education and so on, within the clinics and so on, really helps out quite a bit. And I'm glad Nurse said about teaching the doctors and the nurses, because in working in the hospital setting sometimes, or the wellness centers, people quick to criticize our health professionals, our doctors and nurses. And so I'm so glad that you said this, nurse, so at least persons are a bit more open-minded, and they can know what is really happening within our health sectors, and the services that are available to them. Do you have anything to add? Is there anything in particular you all want to speak about? I'm just brushing you all to make sure before I start asking questions again. Something came to mind? No?
One of the things I didn't notice that we did was to let people understand mental health. So we didn't really go into what mental health is and this kind of thing. And I think that is important that we help them understand mental health. And mental health is not okay. The negative aspect of it, where you diagnose with a mental disorder only, but also, having good mental health is important as well. And so how to sustain that. And it would mean that we have different things. When you look at mental health, our emotion is involved, psychological, social well-being as well. All of that makes up mental health. And so these things have to be functioning in so that we now can enjoy good well-being. So, for example, social well-being. What is your relationship like? Who are your support system? Family members, friends. That is important when it comes to mental health. Yes, when you're looking at emotions, you know, being aware of your emotion, knowing who you are, how you respond to certain things, that is important. That you'll be able to detect, like you said earlier, depression, the symptoms, knowing that the symptoms, knowing when something is not right, so that you can pick it up and maybe go to the health center and say, you know what, something is wrong. I may not know exactly what it is, but I think something is wrong. So you can, talk it out there and be able to come up with something so that, you can get the help, early detection. And so that is important when it comes to our mental health, and not just looking at the conditions, but maintaining good mental health, exercising, eating healthy, taking care of your physical health will also promote good mental health as well. Having healthy relationships, not toxic ones, right? So that in itself promotes good mental health.
Is there something called financial health?
Well, finances also all of these contribute to our mental health, because if you're always in financial problems, then that stresses you out. And so how do you manage it? So having good financial management contribute to good mental health. Even if you do not have $1 million,
Mm-hmm.
Whatever you have, you're content with it, you know how to manage it. And that in itself can make you live a stress-free life. You don't, even if you have $1 million and you still stressed out because you're always on the lookout who's going to steal my money. That's stress. So everything has to balance itself off, and taking care of things, managing our life on the whole. That is important.
And I tend to agree with you, because I remember we had another program. I'm not sure if it was with Nurse Felix or Nurse Donomy, and one of the things that we were saying is that having that me time, especially for women, working mothers, is so important because at the end of the day, you are a working parent. It could be fathers too. You are a working parent. You have to manage the house, the children, the finances, and all of that brings about, some level of stress. And if you don't manage it properly, it can really have an effect on your mental health because some of us, that's our daily lives. Work, home, husband, children, or husband, work, home, wife, children, and these things can really have an effect on our mental health. And like you were saying, the exercise, the emotional health is very, very important. And I'm so glad you touched base on that also. No, Sajis, you want to add anything? No?
Not
You
at
hear
this
me?
point.
Oh, no, that is my, okay, wonderful. Um, I, I, with everything that is happening, especially online with modern technology, the internet, um, our children, especially our children, our teenagers, are so hooked on to modern technology and what they're exposed to. I know that we're saying as parents we're supposed to have some hold on, help me, parental intervention, or how they call it, where the parent can actually see what the child is doing online or something thereabout. How you call that?
Supervision.
Not supervision. There is the app
Control.
for these things where,
Control.
Parental.
yes,
Control.
parental control. But we all know our children sometimes are more tech savvy than us.
Yeah.
They know the technology more than us. And a lot of the things that our children are exposed to, I mean, it scares us as parents or guardians. Do you have any advice for these parents? Because I know the things that children are exposed to can really affect their mental health. Do you have any advice for parents or any situations that you have come across and you want to share that experience with parents out there as it relates to children that are exposed to our internet and the stuff that they see on the internet and they read?
For me, I would say to pay attention to the children. I mean, you know them better than, going to a counselor or a professional, you know. So pay attention to them. If you give them the device, you know, create that relationship where you guys can talk about things. It may not always be easy, but you create that avenue. And be informed yourself, because you may say, okay, I don't know how to go on FaceTime or TikTok and this thing, but the same way that they get to know how to manage that app, you can find out yourself and be informed as to what it is that they're doing. Learn it yourself so that you know how to understand what's happening there, because if you don't go into TikTok, you'll not know what TikTok is about, and you'll not know how to handle the situation when it presents itself. So educate yourself. You have a young child coming up, you have a teenager. There are certain things that you need to be aware of as a parent, and don't leave to a professional, you know. Um, so educating yourself is one thing. Creating a atmosphere where you can speak to your child about those certain things. Try to be the first person that they get that information from, in certain situations. Have that open relationship where you can speak to them. So that is important. Sometimes, especially the younger ones, when they go to school for the first time in kindergarten, and they have spent so much time at home, and they go and the teacher said something and they will say, no, mommy said that X, Y, and Z, because they got that information, and so they're so convinced that this is the information, this is the right thing. What you're saying is not true. Mommy said this, daddy said that. And so we try to create that relationship where your words, whatever you say to them, is what they will hold on to.
Messages?
I totally agree with Miss Dima. Um, Education is the key. After we educate the parents would need to educate the children on the use of the devices. Sometimes we just give it to them and maybe not say anything, hoping that they don't go onto the sites we don't want them to. Um, and be open to the discussion, non-judgmental. If you hear they come to say something, don't be start judging them. Just listen. As much as you want to say something, just try to listen to what they're saying and guide them accordingly. And don't ever think that they are too young to know something or
To
to
learn.
hear something. Because I remember I was still talking to my son about pornography. Tell me, mommy, you're 4 years too late to start talking to him about it. So but remember that they sounds they want the information, we try to give it at their age as much as possible. Give the information at their age, or if not, we can't get somebody else, a friend, a relative who figure that can give them the information that we want to give. Yeah, that's it. Thank you.
I when I heard that, Nurse said, she said, do not be judgmental. I'm saying as a parent, sometimes when you speak to the child and the child give you a response, at that time you don't even think clearly, you are already responding and so on. So I'm glad you said that. Don't be judgmental, because I'm a parent too, and sometimes sometimes when I speak to my daughter and then I'm wondering, oh my goodness, that's where we as parents fall short, and we don't even realize that we as parents fall short. So, having said that, we're 5 minutes to the hour. Is there any message you'd like to leave to the public? We'll start with Mrs. Previlus.
Okay. So I just want to reinforce that mental health is equally important as physical health. So take care of your mental health. It matters, and it's our responsibility. It is not the doctors, not the psychiatrists, not the prime minister. It is our responsibility to take care of our mental health. And so, with that being said, if you require the services that we provide here at the Millennium Heights, remember that we have our outpatient services available on Tuesdays, Wednesdays, and Thursdays from the hours of 8 to 12:30. We also, and that is through referrals only. We also have counseling services available for free. That's for free, and we we also do that via appointments only as well. If you're also in crisis, you can also reach out to the suicide hotline, which is 203, and somebody will be there at any point in time to assist you. And there we can provide you with the services available They can connect you to an agency, they can connect you to a counselor, they can connect you to whatever help that you may require. So that is 203, the suicide hotline. Okay, thank you.
The Juste would like to leave a
Yes, to just reminding everybody that tomorrow is World Mental Health Awareness Day, and our theme is mental health, a universal human right. And we all have a right to mental health, where we live comfortably, be able to take care of ourselves, look after others, contribute to our community, manage stress. So, and if you need help, visit our health centers. Make an appointment, visit our centers. Thank you very much.
don't forget they have to wear the green. Green represents mental health.
Yes, green or yellow.
Green or yellow? Okay,
Yes.
wonderful. Erlani said he already have his green shirt on. This morning I was actually looking for something green. I didn't have anything green. Um, let me just say thank you so very much. Nurse Regis is no stranger to us, but Mrs. Previlus, it's a pleasure to have you. We do
Thank
hope
you.
that you will be back on our program. Like I said, we do have a one mental health topic every month on Casualty 911, especially to our listeners, because we believe that mental health is integral in our health and especially in our communities within the country, Soufriere and Chose region, likewise island-wide. So we really focus on mental health and we, like I said again, I'm hoping that we continue that collaborative effort um, within the ministry, especially the Bureau, alongside mental health, and continue creating awareness in our community. One of the focus we have been focusing on is women and mental health. But now I remember Nurse Doname was saying we seem to forget about the men and so on. So, hopefully as time goes by, we incorporate more the men more into our topics and so on. So, again, thank you, both of you. Don't forget, like Nurse and Mrs. Privila said, the services are available. You just have to make time, come to the wellness centers, come to Soufriere Hospital. And Mrs. Privilege, you didn't leave a number for OKU, but somebody can always look it up on the
Yes,
on
that's
the directory.
458 6500.
458
6500.
458 6500, and they normally deal with referrals, right?
Yes, yes.
Referrals. All right, wonderful. Again, thank you. Do have a wonderful and blessed day, both of you, and take care and enjoy the rest of the week.
Thank you for having me.
You're
Thank you.
welcome.
All
All
the
right.
best.
All right. Bye bye.
Mental health is an issue for